Good day, everyone. Today, I want to talk to us about joint massage. I had this patient that came to our clinic with a complaint of knee pain. With the x ray, it was evident that she was already at stage 2, late stage 2 of osteoarthritis of the knees. We commenced her on regenerative treatment and encouraged her that it's going to take a bit of a time for her to achieve significant relief. But by the time we got to third session, we didn't see her again. 4 months later, she came back with more severe pain and even more difficulty to walk. The story was that people started suggesting to her treatments she could do since she wasn't really improving with the regenerative treatment. And what was suggested for her was to go for joint massage. Apparently, the massaging of the knee worsened the degeneration in her joint. It's not the more stronger the massage, the better. We're trying to encourage you to do gentle massage, which is allowed even when you are doing regenerative treatment. Please, I want you to pay attention to watch this video to see the technique of massaging your joints. First of all, you need to realize that your joint is a complex structure made up of different tissues, majorly the ligaments, the cartilages, synovial membrane, synovial fluid, the bone itself, and all that. While massaging, you have to have these things in mind. All it takes is simply warm up your knee, rub balm, any balm you have, and gently rub your hands around that joint. It can be any joint, but use this technique like a rubbing pomade around your joint. No force at all. Then, when you want to touch, gently touch with your fingers. You can see how the man is pressing around the attachment of the ligaments and the movement where the tendons of the muscle passed through. With this kind of rubbing, you are increasing the blood supply around that area, which is what you need for the blood to bring in the nutrients, the oxygen needed for the healing of that joint. If you apply strong pressure, you are enhancing the inflammation around that joint. Okay, so all the areas of the joint can be massaged. This is the method known as kneading. You are applying gentle pressure around the joint, around the muscles. It helps to relax the muscles because in arthritis, especially arthritis of the knee, because of the fact that the ligament has failed, the muscles around that joint will tense up to do the work of the ligaments and the tendon. And that tension created by the muscles will not be allowing blood to flow. So with this kneading and the gentle massaging, you are relaxing the muscles, allowing blood to flow around the joint. This can be done even at the back of the knee. Many people complain that their own arthritis gives them pain at the back of the knee. That pain can be the tension in the tendon, the tension in the ligament, or even the tension in the muscle. Gentle massaging, having warmed the joint with any balm, even with warm water, using towel, put in the warm water and use it to cover the knee for some minutes, and then begin this gentle massaging of the joint is all you need. Truly, you don't really need anybody to do these things for you. You can do them by yourself. But this massaging becomes more effective when you are already regenerating the joint. On its own, it cannot do much. People have this massager that they call it hammer that hits on your joint. You don't need that. Just use your hand to tap around your joint as the man did. And when you are doing that, please take a deep breath. Oxygen is needed. As you're breathing deeply, you're taking in more oxygen that helps to get oxygen to the joint. By the time you are done, drink enough water. Drink enough water to help in the removal of byproducts and you feel light. So these are the advantages of massaging your joint in the right way. Thank you very much for your attention.